Good afternoon, everyone. Welcome to the Health and Social Services Subcommittee on Appropriations budget hearing today. It is February 14th. Happy Valentine's Day. We will be hearing today from DHS Family Investment. We're excited to hear from you today, so thank you for joining us. And we will begin, as we always do, with our DLS analyst report. Welcome, Ms. Zimmerman. Take it away.
Chair, I'm going to begin on page 1 of the analysis. The fiscal 2025 budget for the Family Investment Administration increases by about $69 million, or 2.6%, to $2.8 billion. I will note this increase is a little overstated by about $10 million. You may recall from last session, there was funding for the food banks and the dedicated purpose account. That funding has been transferred to the department to administer in fiscal 2024, but does not appear in the working appropriation. In fiscal 2025, it's budgeted directly within the Family Investment Administration budget. If you turn to page 7, this begins the discussion of the agency's performance. In general, applications for benefits are required to be processed within 30 days, though expedited SNAP applications are required to be processed within 7 days. If you turn to Exhibit 1 on page 8, you can see that this translates into lower average days to process applications for SNAP compared to TCA and TDAP. Application processing times have been higher since the restart of recertifications in January 2022, though they have come down a little in calendar 2023 compared to the calendar 2022. However, the gap has widened between TCA and TDAP and SNAP so that TCA application processing times exceed SNAP by between 8 and 14.7 days, and TDAP exceeds SNAP by 11 to 15.7 days in each quarter. Exhibit 2 shows on page 9, shows the share of applications processed within 30 days between each benefit. Even though TCA and TDAP have similar average days to process applications, TDAP has fewer cases processed within 30 days. In 8 of 10 quarters, TCA had 70% or more processed in 30 days or less, while this was only true in 1 of 10 quarters for TDAP. If you turn to Exhibit 2 on page 10, Exhibit 3 shows a similar story for applications processed in 46 days or longer. This exceeds 25% in all but 1 quarter for TDAP, while this doesn't occur at all for TCA or SNAP. TDAP in particular contains a number of non-financial requirements, including certain additional verifications relating to determinations of disability that impact the timeliness of application processing. However, it's concerning that despite the improvements, TCA and TDAP application processing has fallen further behind SNAP, and we've asked the department to comment on efforts it's taking to improve the application processing timeliness. Exhibit 4 on page 11 presents information on application denial rates. Application denial rates for TDAP have increased since August 22. Since that time, they've exceeded 75% in each month. And beginning from May through October 2023, they've exceeded 80% and reached 93% in August 2023. TCA has exceeded 70% in that same time period and exceeded 75% in 3 of the last 6 months. SNAP application denial rates are much lower and generally under 30%. We've asked the department to comment on the cause of the increases in TDAP denial rates since May 2023. If you turn to page 13, Exhibit 6, this presents information on the share of application denials that are due to missed interviews. Interview requirements were waived through December 2021 from the start of the pandemic for all cases, and for expedited SNAP cases through June 30, 2023. With the restart of that requirement, it was a top cause of denial, particularly for SNAP. The share of applications denied for this reason in SNAP exceeded 20% in 12 of the 20 months between January 2022 and September 2023. In October 2023, DHS received a waiver from the federal government to waive interview requirements again through May 2024. And as a result, this was virtually eliminated as a reason for applications to be denied in October 23. Turning to case closure information, Exhibit 8 on page 16 shows the share of case closures due to failure to recertify for the different programs. This is by far the leading cause of case closure for SNAP cases. It exceeded 80% in 5 of the 7 quarters since the restart of recertification. In TCA, it's also a leading cause of case closures, but it is much lower of a cause. It exceeded 50% in 1 month or 1 quarter, but in the last 3 quarters has been less than 40%. It is a much lower cause of case closure for TDAP, but it has trended up in recent months or recent quarters. On page 17, Exhibit 9 shows the information on the share of case closures due to failure to provide verification or other kind of cooperation related to the program. This is one of the primary causes of case closure for TCA, and it was over 40% in 4 quarters and over 50% in 1 quarter. And we've asked the department to comment on efforts it's taking to reduce case closures due to failure to provide verifications. If you skip ahead to page 19, this begins a discussion of the Public Assistance to Adults program. This program provides a monthly benefit to assist individuals in certain types of living situations, including like adult foster care programs, certain rehabilitative residences, and assisted living. Individuals must have a verified need for those protected living arrangements and must be applying for SSI or SSDI. DHS generally provided the same flexibilities as it did for the other public benefit programs to recipients of this program. Exhibit 11 on page 20 shows the average number of recipients in the program since fiscal 2016. As you can see, prior to the pandemic, the caseload was declining, but at a relatively slow rate of less than 1.5% per year. Beginning after the pandemic started, the caseload decline increased fairly rapidly and was more than 7% in each fiscal 2020 and 2021. With the restart of recertifications in January 2022, the caseload decline substantially accelerated with a decrease of about 25%. This has slowed somewhat at the start of this fiscal year, but was still over 3%. If you turn to page 21, Exhibit 12, this reviews the reasons for case closure. The top 2 reasons for case closure are similar to other programs in that a failure to recertify was more than half of the case closures for this reason and peaked at 85% in May 2022. In the last couple months, this has come down to about 40%. The other primary cause is no eligible members, and this is usually kind of non-financial factors. The increase, given the relative stability in the program caseload prior to the pandemic and the more limited impacts of the economy on the recipients, it's unclear why the caseload declined so rapidly with so little rebound after the initial closures. And we've asked the department to comment on outreach efforts to these recipients and potentially eligible individuals to ensure they're aware of the program and the requirements. Page 22 begins some discussion of the fiscal 23 budget. The supplemental budget, number 5 in that year, included $35 million in the dedicated purpose account for funding an additional $45 per recipient per month benefit for TCA and TDAP recipients above their regularly calculated benefit. This cost about $33.5 million rather than the $35 million that was allocated for this purpose. Although DHS did not appear to have spending to justify the full use of the $35 million, the DPA funds that were available for this purpose were reported as being spent in full. Language on that appropriation required that the funds revert if they weren't used for that purpose. However, the funds did not appear to have reverted and appeared to be used in full, and we've asked the department to discuss why the funds did not revert as required. Beginning on the bottom of page 22, this discusses the implementation of about $6.5 million that was added to the Family Investment Administration budget in Section 19 of last year's budget bill. The largest share of these was $5 million for the Maryland Office for Refugees and Asylees for assistance to immigrants relocated from other areas. As of the end of January, the department reported it had plans to spend $4.7 million for 4 grants, which are detailed on page 23. The remaining $300,000 was still to be allocated. The other $1.5 million was for a variety of individual grants through the Office of Grants Management. Those are listed on page 24 in Exhibit 13, along with the status of those grants. The department, as of January 26, had executed grant agreements with 7 of those grantees, with 2 additional ones in process. One of the grantees was no longer, did not exist by the beginning of the fiscal year, so those funds will revert. This funding generally does not continue into fiscal 2025, with the exception of the funding for the Maryland Food Bank and the Capital Area Food Bank. The fiscal 2025 budget includes 6 proposed deficiency appropriations totaling $20.4 million in family investment. 2 of those adjust funding for TCA and TDAP based on anticipated caseloads, providing a net increase of about $2 million to the assistance payments program. The largest deficiency appropriation totals $8.7 million, and it's related to a new call center contract that was approved by the Board of Public Works on January 31st. The fiscal 2025 budget includes an additional $12.3 million increase for that purpose. Although it's budgeted only within FIA, the department indicates that this is a department-wide funding for a department-wide call center contract. The remaining deficiencies provide about $6.9 million for employment and income verification, contracts $1.8 million for asset verification, and the remaining $1.1 million is related to a relocation of an office. The total fiscal 2025 budget totals $2.78 billion. As I noted earlier, 86% of that is in assistance payments. Exhibit 14 shows that spending by various activities, by the various benefit programs. Over $2 billion of this is for the SNAP program, and that represents 74% of the total budget of FIA. TCA represents 5.6% of the total FIA budget. Exhibit 15 on page 28 presents the areas of spending for the remainder of the budget. This totals about $394 million, and about half of that spending is related to personnel. Exhibit 16, that begins on page 29 and continues on for the next couple of pages, show in more detail the areas of change within the budget. I'm just going to highlight a couple of them. The largest non-assistance payment change is in personnel, related to a department-wide funding of $19 million, which is going to cover a variety of personnel costs relating to filling vacant positions, supporting contractual conversions, and aligning overtime and other costs with experience. If you turn to page 32, this begins a review of the kind of adequacy of the general fund spending for the public benefit programs. Exhibit 17 focuses on the caseload trends for the TCA, TDAP, and supplemental SNAP benefit for seniors program. As you can see, with the restart of recertifications, the TCA and TDAP caseload declined. Each declined with about a 34% decline in TDAP in the first half of calendar 2022, and about 16% for TCA. After this initial decline, caseloads did rebound in TCA before declining once again through August 2023. That was about a 12.5% decline from that period. Since in fiscal 2024, the caseloads the number of recipients have been higher, have kind of generally increased, but it did fall below 50,000 in December 2023. TDAP, however, kind of steadily increased through the period after that initial decline and reached 11,000 in December 2023. This is much closer to the period prior to the restart of recertification and closer to the pre-pandemic levels in the program. The supplemental SNAP benefit for seniors was effectively suspended during most of the pandemic. The emergency allotments that were available for the SNAP program meant that no households received less than $40, which is what you would need to qualify for the program. So the benefit didn't resume until February 2023, when those emergency allotments were no longer available. In that month, there were about 33,000 recipients, which was about 30% higher than the last month of issuances before the pandemic. But that had declined by December 2023, so that it was about 28,000, about 16% decline from the first month of issuance. Exhibit 18 on page 33 summarizes the kind of adequacy of the general fund spending for the programs. DLS, I anticipate surplus in both fiscal 24 and 25 for the TCA program. Although caseloads have risen, the caseload did decline in December 2023, and caseloads generally are lower in the second half of the fiscal year, and with continued kind of economic improvements, we would anticipate the caseload to continue to decline. We also anticipate a surplus in the SNAP supplemental benefit for seniors program. This is really driven by the assumption of the benefit level in the budget. The budget assumes a benefit of $20, which is higher than could be provided under state law for this program based on the federal minimum benefit. The other area of surplus is primarily related to the public assistance to adults due to the rapid declines in the caseload mentioned earlier. This is partially offset by shortfalls in the TDAP program. The budget assumes a caseload similar to what was available or what occurred in fiscal 23. However, as I noted earlier, the number of recipients has continued to increase and is much higher than those fiscal 2023 levels. If you turn to page 34, there's also a review of the SNAP benefit adequacy. As I mentioned before, the allowance includes over $2 billion for this benefit, although this is a decline compared to fiscal 2024. DLS actually forecasts a caseload slightly higher than what is assumed in the budget, but the budget assumes a average benefit of about $490 per month, where the benefit has actually averaged about $333 since October 2023. DLS forecasts only about $1.48 billion will be needed, and has recommended reducing the federal funds for this program by $200 million, which would still leave a substantial surplus in the event caseloads rise. On page 35, there's a discussion of the personnel. Since last year, the Family Investments vacancy rate has declined substantially from 15.3% down to 7.1%. Despite the substantial reduction, the budgeted turnover expectancy increases to 8.64%, which is a level above what they currently have in terms of vacancies. And we've asked the department how they will fully fund salary and wages if the vacancies stay at that level. If you turn to page 37, this begins the discussion of the first issue in the analysis, and it's related to supplemental benefits for periods when children are not in school. Chapters 635 and 636 of 2019 created the Summer SNAP for Children program. This provides a benefit of $30 per month in the months of June, July, August, and $10 in the month of December for school-age children receiving the benefit. The state funds are matched by local funds based on the local cost share formula, but jurisdictions have to apply to participate, and with the funding available, usually not all benefits can be paid Benefits cannot be paid to all eligible children, even in the jurisdictions that participate. The acts mandated $200,000 for the program. The fiscal 2023 and 2024 budget included a total of $5 million. That increase in funding led to a substantial increase in the number of children participating, shown in Exhibit 20 on page 38. In the first couple years, only 4 and 6 jurisdictions respectively participated, serving less than 5,000 children in each year. With the higher amount of funding, 14 jurisdictions participated in each 2023 and 2024, and many more children received the benefit. 4 jurisdictions in 2023 and 3 jurisdictions in 2024 provided additional funding beyond what was required in their local match so that they could serve all of the eligible children in that jurisdiction. And that is shown on page 39, which shows the participation rates. For those 3 jurisdictions, which were Anne Arundel, Baltimore County, and Queen Anne's counties, the jurisdictions, the participation rate is slightly lower than 100% because some children that were initially identified turned out not to still be receiving benefits at the time benefits were issued, and so it's a little less. But in general, about 57% of eligible children in the participating jurisdictions received the benefit in 2024. Exhibit 22 on page 41 shows the funding for the program. In total, with the $5 million in state funds, local contributions total $4.5 million, which was about $1.8 million higher than was needed to meet the required contribution that was primarily to those jurisdictions providing more than was required. The Federal Consolidated Appropriations Act authorized a new optional nationwide permanent summer EBT program beginning this summer. In the initial year, the benefit is $40 per month per eligible child, and that will increase in subsequent years based on inflation. States that participate are required to automatically enroll all those receiving free and reduced price meals in the school year preceding the summer without additional application, but also make an application available for others who are not eligible at that time. The program requires an individual determination of eligibility, and that can be done through the existing application for the National School Meals Programs. This is different than the pandemic EBT benefits, under which all children in community eligibility provision schools were eligible without an individual determination. Children must be attending a school that participates in the school meals program. However, if you receive SNAP, TANF, or certain other means tested benefit, you would still be able to receive the benefit even if you do not attend a school that participates in the school meals program. Households have kind of the entire period from the school year before through the end of the summer to apply to be determined eligible, and they would still receive the full summer benefit. There is another difference between some of the other SNAP and PEBT benefits, which is that benefits remain available to the household only for 4 months, and under the traditional SNAP program, they're available for 12 months after distribution. States were required to submit a notice of an intent, which Maryland did, and was in one of the initial groups, was in the initial group that was announced by USDA in November 2023. States are required to submit an interim and final plan of operations. The interim plans were due in December 15th, or as soon as practical, with the final plan due on February 15th. DHS had not yet submitted their initial plan because they said they needed to confirm whether they had funding to allocate to the program. And we've asked the department to discuss the status of these plans, any initial allocation of administrative funds, and other preparations it's making to be ready for the benefit program in the summer. Exhibit 23 on page 44 highlights some of the areas of differences between the state summer SNAP program and the summer EBT program. In general, the federal summer EBT program provides a higher benefit level, but is not available in December as the state program is. More children are eligible to receive the benefit, and it's available in all jurisdictions, whereas the state summer SNAP program is only available in jurisdictions that choose to participate and with limited funding, not all children in those jurisdictions typically receive the benefit. The other primary difference is in the funding source. The benefits are 100% federally funded, and the state only has to share in 50% of the costs, whereas the Summer SNAP program is state and local funds only. The department has introduced legislation to make some minor modifications to the program. However, it does not eliminate the duplication between the program and, in fact, increases the state funding that would be required. The department indicates that it submitted language to amend the bills to provide flexibility in the use of the funds. DLS has not seen that language, but is unclear how the language would modify the bills to provide the flexibility, how it would work in practice given the other requirements of the state Summer SNAP program with local matches and specific benefit levels, or why alternatively the mandate would not simply be removed, as language would not be required to just simply have funds to administer the summer EBT program. The fiscal 2025 budget includes $9 million in general funds under the Summer SNAP program, but this is intended for administrative costs with a match of $9 million in federal funds. It also includes a kind of a placeholder for the local match of $1.6 million and also $60 million for the benefits. The funding for the administrative programs is funded entirely within the Assistance Payments Program, which is a program intended only to be used for public benefits and not administrative costs. DLS recommends language transferring the funds, administrative funds for the summer EBT program to another program, and recommends deleting the special funds, which will not be received since there's no state funding for the Summer SNAP program. Issue 2 begins on page 45 and reviews the replacement of benefits due to EBT theft. The Federal Consolidated Appropriations Act required reimbursement for SNAP benefits lost due to skimming from October 1, 2022 through September 30th, 2024, and provided for the federal funds to be used for that purpose. They were not previously and will not be after that date an authorized use of the funds. There are limitations on the replacement under the federal program. The state passed legislation, chapters 171 and 172, were emergency legislation last session to require DHS to restore benefits lost due to EBT theft. These benefits were required to be automatically restored without additional action by the household if an investigation showed that they were lost due to this theft. And the department was prohibited from placing limits on the number of months in which households could receive the replacement benefits. They were also required to restore benefits lost due to theft that occurred between January 1, 2021 and October 1, 2022 by September 1 of 2023, and those are periods not covered by the federal legislation. Maryland was the first state to receive approval of its state plan under the federal program, and it began implementing in March 18 of 2023. Exhibit 24 on page 47 shows how those benefits have been provided, both to the number of recipients and the total dollars of expenditures. In fiscal 23, about 7.4 million were provided. About 5 million of that was was for SNAP, and 2.4 million for cash assistance. In fiscal 24 to date, about 9.5 million have been provided, of which 7.6 million is for SNAP, with the remaining for cash assistance. The fiscal 2025 allowance includes a nearly $28 million for this purpose. About 26 million of that is in general funds, and that's because after September 30th of 2024, federal funds will no longer be available for that purpose. DLS estimates a lower need for these benefit dollars and anticipates that only $15 million of general funds will be needed for that purpose, and recommends reducing the funding provided by $7.5 million, which still does leave a surplus of several $1 million in the event that benefits provided are higher than anticipated. Beginning on page 48, discusses some of the other actions the department's taken to address skimming, including some requirements as part of a new RFP for their EBT system. They have also, under their current vendor, made modifications so that recipients can easily lock and unlock their EBT card through an app and access activity alerts. And we've also asked the department to comment on the additional steps they've taken to reduce EBT theft. The SNAP program contains two types of work requirements. The one I'm going to focus on here is for able-bodied adults without a dependents, referred to as ABODs. ABODs can only receive benefits under SNAP for 3 months in a 36-month period unless they're working or participating in an employment training program for 20 or more hours per week. There are certain people who are exempted from this requirement. During the pandemic, these requirements were suspended until 1 month after the national public health emergency ended. The state did not have a waiver to suspend these requirements after the period ended. However, 5 jurisdictions do have a waiver through June 30, 2024. Individuals began hitting that time limit in October 23. The Fiscal Responsibility Act made a number of changes to the ABOD requirements with disparate impacts. These are identified on page 50. It increased the ages for people to be subject to these requirements. Traditionally, this has been only up to age 49, and it phased in a increase up to 54 through October 1, 2030. However, it also provided additional exemptions from those requirements, including homeless individuals, veterans, and children who had formerly been, or adults who had formerly been in foster care up to age 24. It also made some requirements to discretionary exemptions the states are allowed to use for individuals who have hit the time limit so that their benefits aren't terminated. It reduced the number of these benefits available and eliminated the ability to carry over benefits kind of in perpetuity beginning in federal fiscal 2026. The department has been using those discretionary exemptions to prevent individuals from having their cases terminated. However, the department anticipated exhausting those discretionary exemptions in February 2024. Exhibit 25 on page 52 shows the number of ABOD individuals as of November 2023 in the various jurisdictions in Maryland. And we've asked the department to comment on outreach efforts to those potentially impacted to let them know about the changes and how to maintain benefits. The next issue focuses on work requirements in the TCA program. Turning to page 55, this presents some information on changes made in the Fiscal Responsibility Act. So as part of the work participation rate, states can reduce the rate that they have to meet with a caseload reduction credit. So if your caseload is lower than it was compared to a base period. Beginning in federal fiscal 2026, the base year for that calculation is lowered or is changed from federal fiscal 2005 to 2015. The state had a lower caseload of about 4.5% in fiscal 2015 compared to the prior base year. It also eliminated the ability of states to count certain assistance as part of people receiving certain assistance as part of that requirement. It also added reporting requirements that focus on outcomes from work measures and authorized a pilot project for up to 5 states for participation to use negotiated benchmarks for work and family outcomes in lieu of the work participation rate. The U.S. Department of Health and Human Services released a request for information in November 2023 asking for information about various provisions related to the work outcomes and authorized pilot project. And we've asked the department to discuss whether it expects to apply to participate in its readiness to implement the new measures of work outcomes. Page 57 begins the recommended actions. The first recommended action is language that restricts the funds in the assistance payments program to be used only for that purpose. This is language that's similar to other entitlement programs. This is a little bit different this year than was adopted last year. It authorizes a transfer to the foster care maintenance program and child welfare services for the purpose of replacing TANF spending. This was the recommendation that was mentioned in the DHS overview. And the second exception would be to transfer the administrative spending for the summer EBT program to another program, since that administrative expenses are not not really appropriate for that assistance payments program. Recommendations 2 and 5 contain the language that would transfer the summer EBT administrative funding to another program. Recommendations 3, 4, and 6 were discussed earlier in my presentation. Recommendation 7 is annual narrative, requesting a report on application processing times, denial rates, and case closures. And the final recommendation on page 60 asks for information about the implementation of the summer EBT program, administrative costs, and participation. The remainder of the analysis I won't cover, but includes updates on a variety of topics and summaries of some of the JCR reports that were requested. And with that, I can take any questions.
Thank you, Ms. Zimmerman. It's a very thoughtful analysis, very thorough. Are there any questions for a DLS analyst? Okay, thank you so much. Appreciate it. We will now call our DHS speakers to the table: Secretary Lopez, Principal Deputy Secretary White, and Acting CFO Resnick. And you may begin when you are ready. Thank you.
Set up. Good afternoon, everybody. Happy Valentine's Day. Just setting up here. Make sure we have everything ready to go. All righty. Good afternoon, Chair Shetty and members of the subcommittee. My name is Rafael Lopez, and I serve as the Secretary of the Department of Human Services. We'd like to thank Governor Moore, Lieutenant Governor Miller, our colleagues at the Department of Budget and Management, and the budget committees for their continued support of our department. We are grateful to the Department of Legislative Services analyst, Tanya Zimmerman, for her budget analysis, as well as her colleagues. Joining me at the table today, to my right, is our Principal Deputy Secretary, Carnita White, and to my left, our Acting Chief Financial Officer, Carol Resnick. We also have senior members of our leadership team present in the room to answer any questions should we need additional assistance, including Director of Allegheny County Department of Social Services, Courtney Thomas Winterberg, the Assistant Secretary for Policy, Heather Zanoni, Chief of Staff, Webster Yee, and Acting Executive Director of the Family Investment Administration, Augustin and Tavanaka. At DHS, we empower every Marylander to reach their full potential by providing preventative and supportive services, economic assistance, and meaningful connections to workforce development and career opportunities. We are committed to unlocking opportunities for the over 1 million Marylanders we serve each year. The Family Investment Administration is the largest service program within DHS, accounting for 67% of the department's $4.1 billion budget and serving an average of 943,000 Marylanders annually. This team collectively administers federal economic assistance programs that ensure seniors don't have to choose between buying medicine they need and paying their rent, helps families put food on the table, helps keep children in their homes, and fosters connections to work and career development so Maryland does not continue to leave potential on the table. Today, I'd like to draw your attention to 10 key pieces of our budget and work that frame up our early contributions to deliver on Governor Moore's goal of ending childhood poverty in Maryland. First item I'd like to address is the issue of stolen benefits. Prior to this administration, the pleas of Marylanders whose food and cash benefits were stolen by thieves went unanswered. Governor Moore's charge is clear. We want to do right by Marylanders. And since March 2023, our department has replaced over $20 million in stolen benefits to over 31,000 Maryland households. Maryland became the first state in the nation to reimburse stolen benefits and combat nationwide organized theft. While being first was not the assignment, we moved with urgency to respond to Marylanders in real time. We added new security features for our customers so they can lock and unlock their EBT cards when not in use, and also receive SMS text messages and emails to monitor card transactions, just the way we'd expect for our own bank and credit cards in our wallets and purses. We launched our work in partnership with customers themselves by engaging them personally. We worked with community-based organizations, advocates, and even those that have sued us. We did so in the spirit of partnership and transparency, and in English and Spanish to better serve our customers. No protection for dispersed federal entitlements existed prior to January 2023. And the governor's budget includes a total of $27.8 million to continue efforts begun in 2023 for replacing stolen Supplemental Nutrition Assistance Program, or SNAP, benefits, as well as temporary cash assistance, or TCA, benefits. Of note, this proposal represents $26.2 million in state general funds and approximately $1.6 million in federal funds. As you know, Maryland budgets 1 year at a time, and this funding will enable DHS to reimburse stolen benefits to Marylanders through June 30th, 2025. As we move into year 2 of our work, we are enhancing the Stolen Benefits Replacement Program to provide more relief to families affected by benefit theft. You'll be hearing more about our approach via HB 1434, which is scheduled for a March 5th hearing. And we will also continue to move with all deliberate speed to use chipped cards in Maryland to secure people's benefits. And we are partnering with federal agencies to decrease the amount and frequency of thefts we are seeing nationwide. We cannot do this work without partnerships at every level. I also would be remiss if I didn't mention publicly and on the record that one of the things that this administration does, and to which I hold all of our team members accountable, is living and working on behalf of the Moore Miller administration values. And one of them is about moving with integrity and leading with confidence to tackle hard problems, as well as being honest and maintaining strong moral principles. It's come to my attention that many members of the General Assembly have been told that DHS does not want to fund benefits, and that is simply not true. And so I want to say loudly and clearly on the record, that is fiction, not fact. And I want to make sure that we, as a team, move with integrity about making that clearly and clearly shutting that down on the record. The next item I'd like to speak about is the summer EBT program. The summer EBT program is critical to our strategy to spend more strategically in our work to end childhood poverty. With summer EBT, we will leverage federal funding to expand benefits currently provided under the Maryland Summer SNAP Act to serve all eligible children across the state. Building on this legislature's investment and progressive thinking many years ago as they launched this in the Summer SNAP program, we will draw $69 million in federal funds per year to do it, no longer leaving federal dollars on the table for which Marylanders are eligible. We will help families feed their children in every single one of the jurisdictions across Maryland, which is not the case as of now. When the state Summer SNAP program launched in 2019, we served 3,923 children in 4 jurisdictions, and during the summer of 2023, we served 90,571 children in 14 jurisdictions. A lack of local funding and bureaucratic barriers kept many counties from opting in to Maryland's Summer SNAP program. By innovatively and seamlessly combining the federal Summer EBT program with Maryland's existing Summer SNAP program, we'll help feed 500,000 children across Maryland in every single one of its 24 jurisdictions. We will provide benefits to all children eligible for free and price-reduced school meals, including those not enrolled in SNAP as of today. On the third topic we'd like to lift up for you, we want to talk about enhancing our outreach with our community partners, because we simply can't do this work on our own. We partner with 31 community-based organizations that conduct outreach to help enroll families in SNAP and cash assistance programs throughout the state. These organizations play a vital role by providing application support to ensure that households renew their benefits on time. This partnership helped make sure that 21,766 households submitted an application or renewed their benefits last year. We are especially grateful to Maryland Hunger Solutions, Lifestyle of Maryland, Benefit Data Trust, and others who helped us roll out the Stolen Benefits Replacement Program. They built on their experience to make our work stronger. They helped answer calls from families that were defrauded and helped them submit claims for benefit replacement. They responded to our call to test our online application to make sure that it was simple and seamless. We could not have done this work without their partnership, and we are deeply grateful. We are pleased to report that the U.S. Department of Agriculture approved our request of nearly $6 million to support the outreach efforts provided by our partners, and we look forward to exploring new ways to improve, learn, and grow together with our partners as we serve Marylanders. The fourth issue we'd like to bring up to your attention is the importance of partnerships to create career paths for more customers. As we continue to unwind from the pandemic, we are committed to working with our partners at the state and local level to do 3 things. 1, to increase access to career training programs. 2, to streamline workforce development. And 3, to remove barriers to employment such as childcare and transportation. Our anti-poverty efforts can never be fully achieved without clear strategies to provide education, training, and support to our customers on their journey to thriving economically. In federal fiscal year 2023, only 4,508 temporary cash assistance, or TCA, and 3,897 SNAP customers participated in employment and training programs. However, there are more than 70,000 Marylanders who are ready, willing, and able to participate in workforce development programs. To enhance participation and ensure all eligible customers continue to receive food and cash assistance benefits without interruption, our goal is to improve the quality of our programs by increasing options for customers. We will work to establish SNAP employment and training, or ENT, programs in communities that have been underestimated, undervalued, and underserved, particularly in Eastern and Western Maryland. We will partner with the Department of Labor to improve access to apprenticeship and other programs that the department funds. We will coordinate with Workforce Innovation and Opportunity Act partners to connect customers who are working but want to advance their careers in a new direction. The fifth item I'd like to bring up is around enhancing our SNAP payment accuracy. As we work to build trust and reestablish strong working relationships across the state, we will move with integrity and transparency, two additional values of the Moore-Miller administration. And on June 30th, 2023, the United States Department of Agriculture, USDA, announced federal fiscal year 2022 SNAP payment error rates for the first time in 3 years, given the COVID-19 public health emergency. Unfortunately, Maryland now has the dubious distinction of having the second worst error rate in the nation. Since receiving the news of the state's error rate, we have moved urgently and remained outcomes focused on getting this right, because the consequences for not turning this around will only hurt the very Marylanders in whose names we serve. We are working proactively with our USDA partners and communicate with them regularly on our action steps. I want to be crystal clear on the record that the SNAP payment error rate is not a fraud rate. This isn't about our customers doing something wrong or incorrectly. It's about us and our department making errors, mostly. Payment errors are largely unintentional, and in each case that was reviewed, all errors were corrected by the department. We also learned that high staff turnover rates during the pandemic, especially at a time when new applications for SNAP benefits were soaring, created administrative burdens and delays for the local departments of social services who lead this work on the ground every single day. We must continue to do more to invest in our people, our teams, and training to make sure everyone is up to speed on policy and is supported to do this work well. We're pleased to share that since January 2023, we hired nearly 200 new family investment caseworkers and supervisors, reducing our program vacancy rate by half. We are working closely with our USDA partners to develop and implement corrective actions that will mitigate errors and ensure timely and accurate SNAP payments moving forward, including additional training. In fact, we have a quarterly leadership call with USDA to make sure we're on time and on task to get this right on behalf of Maryland. We will lead by taking accountability for continuous quality improvement. And we also corrected more than a dozen critical E&E system defects that significantly contributed to SNAP payment issues. E&E is the application on the MDThink platform that is the main application in which all of our team members across the state process payments and make sure people get the benefits they need. None of this happened overnight, and yet we're taking proactive steps in the right direction to problem solve for Maryland's future. The sixth item I'd like to bring to your attention involves the Office of Home Energy Programs, and specifically addressing the need to accelerate enhancement of our customer service. Each year, the Office of Home Energy Programs, or OHEP, provides services to 100,000 Maryland households, many of whom are seniors, so they can pay for utilities needed to stay warm during winter months, prepare meals, and power essential equipment such as oxygen tanks and other medical equipment. Unfortunately, for far too long, we have failed to address systemic customer service issues in this life-saving program. Our local administering agencies, or LAAs, are simply not processing OHEP applications fast enough to prevent utility shutoffs. In some cases, it takes months before a customer receives a decision on an OHEP application. This is simply unacceptable. We are taking a multi-pronged approach to improve access to energy programs. We are simplifying the online application. We are setting clear expectations with our LAA partners for case processing timeliness and customer service. And we recently implemented a new standard operating procedure to better identify and prioritize emergency applications for households at risk of experiencing a utility shutoff. Though I've already visited every jurisdiction across the state more than one time, I made a decision after reading so many complaints of Marylanders from across the country, across the state, every single day, that I'm going to personally visit every single OHEP office, excuse me, I'm confusing my acronyms, with our senior leaders to make sure we are learning firsthand about what the challenges are that are being faced, not just by our team members, but by our customers, and to better understand how we can improve the experience for the Marylanders we serve. I hear directly from community organizations and customers every single day, and we must and we will do better this year, and we look forward to reporting on our results to you next year. The seventh item and eighth item are both around how we support immigrant communities, but I want to break them up into two components. The first is a special $5 million that the legislature placed into our budget last year that I'd like to speak to. As was shared by our analyst, our department is home to the Maryland Office of Refugees and Asylees, or MORA, where we partner with the federal government and local community organizations to better support immigrant communities. Our budget proposal includes additional funding to enhance immigrant integration efforts. Immigrants come from all over the world. They are our brothers and sisters, and they contribute to the vibrancy of our communities in every possible way. They are valuable assets to our state and our nation as they contribute to our economy, they pay taxes, and they add extraordinary diversity to our communities. The $5 million that the legislature provided to our department in the FY24 budget paid for essential services including housing, transportation, healthcare, case management, employment and training, and legal assistance that would otherwise not have been covered. We strategically invested in 4 projects. First, we looked at emergency response. We partnered with community organizations to address the urgent and immediate needs of migrants and asylum seekers, such as temporary shelter, food and basic needs, emergency health care, transportation assistance, educational support, and most importantly, holistic case management support. Second, we looked at respite care. We worked to make sure and provide short-term relief and a respectful welcome for incoming migrants, providing a safe place to stay and support to continue their journeys. Third, we looked at comprehensive health care. We worked to leverage an existing community-based healthcare infrastructure to make sure immigrants who are ineligible for traditional Medicaid and have no medical insurance had access to care. And fourth, we looked at long-term resettlement support. For asylum seekers who have chosen to resettle long-term and call Maryland home, we worked on a pilot project to support families through a range of services that facilitate integration into local communities. We would like to publicly acknowledge and thank a few key partners that helped make this come to life this year. Within the Montgomery County government, County Executive Mark Elrich, Chief Administrative Officer Rich Madalino, and members of his team Bibi Otero and Sonia Mora have been instrumental in modeling how we strengthen state and local partnerships required to respond more seamlessly. The leadership of community organizations like Healthcare for the Homeless, Seventh-day Adventist Church, Identity Inc., and SAMU First Response have been allies in our collective and humane response and service to the people of Maryland. Finally, I wish to thank Secretary Strickland and his team at the Department of Emergency Management. We are grateful for their leadership as our partners every step of the way. Eighth, and connected to this very topic, I want to address the issue of building their capacity in communities to support immigrants and asylees. The state of Maryland partners with federal government to resettle individuals admitted to the United States as refugees or have been granted humanitarian immigration status. And of note, it strikes me that as I go around the state, I'm often asked about Maryland unfairly spending money on asylees and refugees. Again, for the record, all of that money comes from the federal government. So while we all contribute to that fund, we're not taking away from other people. It is a collective investment in that fund, and Maryland uses those funds wisely to invest in the people who have chosen to make Maryland their home. The people that we have the honor of serving have been uprooted from their homes because of religious, racial, or political persecution and are unable to return. During federal fiscal year 2023, we served 2,890 refugees, special immigrant visa holders, and other eligible populations within their first 12 months from their date of arrival in the United States of America. Overall, we helped 5,580 individuals. Using federal funds, we provided cash assistance, case management, job placement services, youth mentoring, school integration services, medical assistance, and much more. The ninth item we'd like to bring up is around course correcting and strengthening MD Think. You've already heard me mention it related to E&E and OHEP, and this remains a central focus of setting a new course for MD Think. We have not been shy in speaking truth about MD Think, which has had significant issues with fiscal management, strategic focus, and operations. We inherited a system hindered by significant operational issues, defects, a lack of human-centered design to more seamlessly serve the people of Maryland, and a significant projected FY23 budget deficit. We took immediate and decisive action. Together with colleagues Secretary Herrera-Scott of the Department of Health and Secretary Savage of the Department of Information Technology, we appointed a new executive director for MD Think, Pat McLaughlin. Together, we've tightened fiscal controls, right-sized the workforce, and paused all non-essential development so we could begin to address the significant oversight and management control failures. Together, we've reduced the projected FY23 budget shortfall from an estimated $100 million down to $6 million. A critical piece of this work is how we are racing the clock to improve the customer experience on the MD Think customer portal. And this is another one of the complaints we hear every day from people across the state. We simply cannot move fast enough to make sure that Marylanders get fast and accurate access to benefits. To be clear, MD Think was not designed or built in a mobile-friendly way, even though most people use their phones to access services. Ease of access on cell phones is but one of the many challenges we are addressing. And though we have multiple strategies at play to address this challenge, we'd like to highlight a positive partnership with Code for America, a nationwide leader in bringing human-centered design to government services. This year, we will make significant design improvements to the MD Think consumer website so Marylanders can get the help they need when they need it. Code for America is helping us better understand the challenges of our customers, our staff, advocates, and community-based organizations, and what they face when using applications that are part of MD Think. We will rapidly prototype a new, simpler application on the MD Think platform later this year. We remain committed to leveraging technology to accelerate access to services, and we must make sure it actually works for the people we serve before claiming it as a finished product. I thought I heard an amen there for a second, but I digress. We will modernize MD Think to be more mobile-friendly and move toward a reality that universally connects benefits across agencies. We are not there yet, and we're not there as of this moment, but commit to doing better and holding ourselves accountable for progress. The FY 2024 deficiency request will allow MD Think to focus its resources on course correcting and delivering desperately needed MD Think fixes to several DHS applications that Marylanders and our team members use every single day. They deserve nothing less. The 10th item we'd like to highlight is the importance of aligning our grants with the outcomes we seek. We partner with more than 70 nonprofit community-based organizations across Maryland. We cannot do what we do without the support of people who power these organizations to provide a range of human services, including emergency food assistance, outreach, refugee resettlement services, employment and training services, English as a second language help, and so much more. We are grateful for their service to the people of Maryland. What has been stunning to learn during this first year is how long it takes for us as a department to process a grant agreement or process invoices. I kid you not, every single day we receive complaints by someone about not getting paid by DHS, even though in COMAR and in law we're supposed to pay them in a timely way, but we don't. As someone who has been a leader in the nonprofit sector myself, I know how important it is to maintain a good cash flow, and no organization should have to front the government any money for which it is rightly owed. When we fail to pay our partners on time and make them wonder when that deposit will hit their bank account, we are making it even harder for them to do the work that we have asked them to do on behalf of the state of Maryland. On behalf of the Department of Human Services, I'd like to apologize for the inconvenience we have caused. While it took years to get to this point, we are racing the clock to course correct, and it will take us some time to make things better. This is not normal. And no one should accept this as, quote, and I hear this all the time, this is just the way things are in Maryland, end quote. In addition, many of our grant agreements do not include measurable outcomes. That might sound insane, but it's true. And we'll be changing that moving forward. A good partnership is one in which expectations are clear, where we hold each other transparently accountable for results in the name of those we serve. We are working to change the way we write grants so that a year from now, we can more clearly articulate to this committee and the entire legislature what services we paid for, when, and the results they produce for Marylanders. And all of this will be made publicly available on our website. This budget proposal was assembled in partnership with many of you and others who advocate tirelessly for the Marylanders we serve. We stand ready to work with you to deliver bold investments in a fiscally responsible way to make this Maryland's decade. And now I'd like to turn over to our Acting Chief Financial Officer, Kirill Resnick, to summarize our responsive to the DLS analysis.
Thank you, Mr. Secretary. Thank you, members of the subcommittee. It's a pleasure to be here. Happy Valentine's Day to all of you. I'm going to go through the questions that DLS analyst asked in the analysis one by one. Though some of them are duplicates, I will still go through them just so that we can stay consistent. The first question deals with commenting on our efforts to take that we have taken and plans to take to improve application processing times for both TCA and TDAP. There is an extensive write-up in the testimony that we provided to you. I will summarize quickly so that we don't spend all day, but I strongly encourage you to read through that response. Our Family Investment Administration has a compliance plan in place that is comprehensive and extensive. We monitor our local departments on a weekly, monthly, bi-monthly, every 6-month basis, et cetera, on numerous key metrics, including timely approvals, denials, average days it takes for the department to make eligibility decisions, and other metrics. Failure to meet a 96% compliance by any local department triggers a series of actions on behalf of FIA, including providing technical assistance to the local departments, developing a corrective action plan, visiting in person to assess what's going on at the local department, developing noncompliance mitigation sessions, and much more. The department has temporarily waived interviews to reduce administrative burdens and improve timeliness, though that waiver will expire this coming May 31st. DHS is also improving the application processing timeline this year by implementing 3 key factors. We have implemented workload sharing so that our particular jurisdictions that is behind in their processing, the workload would be assigned to jurisdictions who are ahead of their processing. We're focusing on case managers on the processing of applications. DHS was approved for a new call center, as you had heard in the analysis. Though this is a department-wide call center and would serve all of DHS's programs, the FIA programs, the cash assistance programs, are particularly important in this work. DHS is in the process of requesting a waiver from the federal government to allow our call agents to perform certain functions typically completed by case managers. We expect that call center agents will be able to help customers schedule interviews, update customer addresses and phone numbers, pursue missing information, screen for eligibility, and much, much more. The purpose of the waiver is to reduce the burden on case managers so they can focus on actually processing applications. Our third process is that we are implementing a new software appointment scheduling tool on the MD Think platform coming this summer 2024. Software is called QLess. It's expected to dramatically decrease the number of missing appointments and application interviews and lower the application processing time. The second question, DHS should comment on the cause of increases in TDAP denial rates since May 2023. During the pandemic, TDAP applicants were allowed to self-attest to their disability, and the requirement to provide medical documentation for disability was waived. Since the end of the federal COVID-19 public health emergency declaration and associated federal flexibilities, DHS has resumed the normal program requirements. Therefore, COVID-era cases that would have been denied for lack of medical documentation are now subject to that denial. The third question, DHS should comment on efforts that it takes to reduce case closures due to failure to provide verifications. Missing interviews is among the top 3 reasons for denial and for the time it takes to reduce case closures. Cases remain pending for up to 45 days after an application is begun, so a missed interview and missed supporting documentation results in case closures, either approved or denied, that remain pending for extended periods of time. As mentioned earlier, the department is partnering with the software company QLess to develop an appointment scheduling system on the MD Think platform. With this functionality, customers will be able to schedule and reschedule appointments on their own, which is novel for our department. This functionality will significantly improve compliance with interview requirements and thereby decrease the rate of denial for missed interviews. The other top 2 denial reasons are individuals are over the income requirements and failure to provide documentation to demonstrate their eligibility. The fourth question, DHS should comment on its outreach efforts to recipients and other potentially eligible individuals to ensure that they're aware of the program and requirements to rectify for benefits. DHS partners with 31 community-based organizations that conduct outreach to help enroll families in SNAP and cash assistance programs for which they are eligible. These organizations play a vital role by providing application support and ensuring that households that are due to renew their benefits maintain eligibility. The CBOs helped 21,766 households to submit an application or renew their benefits just last year. In addition to the support provided by CBOs, DHS issues at least 2 case renewal notices to each customer. These include an initial notice and a reminder notice. The initial notice is sent to customers at least 60 days prior to renewal. If the customer has not submitted the renewal application and related documents, a reminder notice is sent to customers 15 days prior to the renewal. DHS partners with Benefits Data Trust, one of our outreach partners, to text customers with a pending renewal. The department sends an initial text and several follow-up texts depending on the status of the application. Fifth question, DHS should discuss why certain funds did not revert. As noted by the analyst, in fiscal 23 year-end close, fiscal 23 year-end close, DHS reported a total of $43.5 million expenditures, of which $35 million were funded with dedicated purpose account funds, and the remaining $8.5 million were funded with the interim assistance reimbursement and child support offset. The offset of other benefit costs in fiscal 23 were funded with the interim assistance reimbursement and child support offset. DHS reverted $173,212 from these 2 funds. Question 6, DLS recommends reducing the federal funds for SNAP by $200 million to better align with anticipated spending. We concur with this recommendation, and we agree with this recommendation. Question 7, DLS should discuss how it will fully fund salaries and wages in fiscal 25, given the higher relative budgeted turnover compared to vacant positions if the current vacancy levels continue. As noted by the analyst, consistent with the governor's Rebuilding State Government Initiative, DHS has made substantial progress towards filling vacancies, not just within FIA, but throughout our department. In preparation for budget submissions for FY25, we completed a salary analysis which revealed underfunding of salaries at about an 8.5% vacancy rate. To address this concern, the governor allotted an additional $19 million. This requested allocation was included in our FY25 budget and will allow the department to continue to reduce vacancies while maintaining the funding for salaries. DHS should discuss the status of its interim and final plans of operation, any initial allocation of administrative funds that it has received, other preparations that it makes to implement for the program, and how it works, and how it's working with the Maryland State Department of Education to ensure that the state will be ready to provide benefits for summer EBT starting this summer 2024. The U.S. Department of Agriculture's Food and Nutrition Service requires that Maryland submit its proposed plan of implementation by February 15th, 2024. Yes, that is tomorrow. DHS is working with MSDE to ensure that an estimated 500,000 Maryland school children receive these benefits starting this June 2024. For more information, you can please see our departmental bill, HB 183, SB 213. Our testimony to that bill is also attached to your testimony here. Number 9, DLS recommends adding language to transfer the funds to administer the summer EBT program to the local family investment program. In addition, DLS recommends deleting the special funds, which will not be needed given the funding for the state share. The $1.6 million placeholder for local match, the special funds, is necessary to implement the existing state law for summer SNAP. If the General Assembly passes HB 183, SB 213, and the corresponding appropriation in the state budget, the new summer EBT program will not require the local match that is represented by the special fund allocation. DHS does disagree with the DLS recommendation to transfer the funds to the local family investment program. The funds should be maintained in the current program to provide more flexibility in program administration. Unlike the current state SNAP program, the federal program gives states flexibility in how they administer their summer EBT. Our approach will include a combination of state and local office staff. Number 10, due to lower estimates, DLS recommends reducing general funds for benefits replacement by $7.5 million. DLS also disagrees with this recommendation. We are working with Delegate Robin Lewis, on a bill to protect state fiscal investment through SB 2. Currently, DHS has been advised by the Office of the Attorney General that SB 2 creates an unfunded mandate on DHS to replace benefits even if there is no appropriated funds. DHS's latest operational guidance is the action transmittal, also attached to your testimony. The number of stolen EBT benefit reports fluctuated since the department started replacing them in March 2023. Cutting the program benefit at this time would cause a significant risk to state general funds should the benefit replacement exceed projections and federal funding expires this coming September 30th. Question 11, DHS should comment on additional steps being taken to reduce incidents of ABT theft. A number of those were covered both in the analysis and with the Secretary's testimony, but you can also attach to your testimony, to our testimony here, is our EBT card theft benefit report. You look at pages 2 to 4, you will see some of the actions that we are taking to reduce those benefits pursuant to Human Services Article 5-609, submitted on September 8th, 2023. As noted in the DLS analysis, additional protective steps are being incorporated into the request for proposals for our new EBT system contract. Question 12, DHS should comment on outreach efforts to those potentially impacted by ABOD requirements at the end of the public health emergency. Maryland resumed ABOD requirements on July 1st, 2023, after a 3-year pause due to the flexibilities provided during the federal COVID-19 emergency. The Federal Fiscal Responsibility Act authorizes new exceptions for veterans, former foster care youth, and individuals experiencing homelessness. FRA also expanded ABOD requirements to individuals age 50, age 52, and ages 54. The department sends notice to households newly subjected to ABOD requirements. The notices explain the requirements and provides a list of steps that the customer may take to meet the requirements or request an exemption if appropriate. The department is taking other measures to support ABODs. The U.S. Department of Agriculture's Food and Nutrition Service approved Maryland's request to waive ABOD timelines in 5 jurisdictions: Baltimore City, Prince George's County, Somerset County, Wycomico County, and Worcester County. The waiver is in effect from July 1st, 2023 through June 30th, 2024. Nearly 50% of ABODs live within the waived jurisdictions. DHS has been using discretionary ABOD slots to maintain SNAP eligibility for ABODs in non-exempt jurisdictions. The department continues to use discretionary slots and has not closed any SNAP households for failure to meet these ABOD requirements. The last question prior to the recommendations is question 13. DHS should discuss whether it's expected to apply to participate in the pilot and its readiness to implement the new measures for work outcomes. DHS awaits release of the federal TANF pilot program instructions and application, which is anticipated this spring 2024. DHS provided comments on the ACF request for information, which are also attached to your testimony. Now moving to the DLS recommendations and our response. The first recommendation is to add limiting language to restrict foster care maintenance payments to that purpose. DHS concurs with that recommendation. Recommendation 2 is to add language providing that the $9 million for the summer EBT program of state funds may be expended through the local family investment program. As addressed earlier in question 9, DHS disagrees with that transfer and requests that we leave that money within the main FIA budget, providing the department maximum flexibility to administer this program. Recommendation 3 is to reduce the electronic benefit transfer theft replacement for theft by $7.5 million. Again, as stated in the response to question 10, DHS disagrees with that recommendation because we frankly cannot predict what the replacement benefit is going to be needed in the next coming fiscal year, and any cut could potentially jeopardize our budget and the state's budget. Recommendation number 4 is to reduce special funding for the summer SNAP program, which is the local jurisdiction match. As noted, these special funds only makes sense if you don't pass HB 183 and SB 213, as well as the corresponding appropriation within the state budget. Obviously, we would agree with that cut if those bills pass and the budget passes. Recommendation 5 is additional language moving the Summer SNAP state portion of the administrative cost to the local family investment program. For reasons stated, DHS disagrees with that recommendation. Recommendation 6 is to reduce federal funding for the SNAP program by $200 million. DHS concurs with that recommendation. Recommendation 7 is to adopt narrative dealing with application processing time, application denials, and case closures. And DHS concurs with that recommendation. Would be more than happy to provide those reports. And finally, recommendation 8 is additional language requiring reporting on the summer EBT program for children, and DHS concurs with that recommendation and is happy to provide that report as well. And with that, I'll turn it back over to the subcommittee for questions. Thank you.
Thank you, DHS team, Mr. Secretary, Madam Principal Deputy Secretary, and Acting CFO. Really appreciate the thorough response. Recognizing Vice Chair Jones for a question.
Thank you so much, Chair, and thank you all for being here today and thoroughly going through the questions for us. I actually want to jump to page 38. Page 38, the analysis is a chart that lays out the number of children per county receiving benefits through Summer SNAP for children FY 2021 through 2024. There's a convenient asterisk. Notably, for last summer, in the column here, 2023 summer asterisk, and it represents identified children. The Department of Human Services reports that substantially fewer children received benefits in each month than the number listed. And if we specifically look at it, it's referencing that between 70 to 80% who are identified for benefits received them. That's conversely about 20 to 30,000 students who are eligible but did not receive benefits. Can you please share some of the barriers the department had in issuing the benefits for all the identified children?
So, for the record, Carnitra White, serving as Principal Deputy Secretary for the Department of Human Services. Thank you, Delegate Jones, for your question. So, as we stated in our testimony, the state summer SNAP program has lots of administrative barriers around it. Some of these barriers, including identifying some of the children who are not already on our E&E rolls and working with the school system in order to determine eligibility of those children. And so that was one of the major barriers of us not being able to issue those benefits, and then other administrative barriers around the timing of when and how agreements were signed with the local jurisdictions as well.
Can I also build? I'm grateful for the Principal Deputy Secretary's response. There's another thing that is worthy of mentioning on the record, which is that it is stunning that Maryland operates one of the state's largest departments and budgets, mostly by hand counting and Excel spreadsheets. And that is the reality of this state right now. So to the Principal Deputy Secretary's point, if you were to ask me right now, can you give us an exact count of these kinds of things and disaggregate it by county jurisdiction and by school, we have to ask our FIA team to extract data in either an external contract and or from MD Think and or from asking a favor of the interim superintendent of the Maryland State Department of Education and make all that data come together to report to all of you. That's the reality we're facing right now. Number two, we actually have so many paper processes that have not automated much of this that we end up having our people process paper instead of actually doing the complex analytical human-centered thinking that we need to do that. So I wanted to say that, Delegate Jones, because what we've found is that as we're launching new kinds of programs, the lift to get them up and running is even more significant when we want to do something like making sure 500,000 Maryland children get their food this summer. We will pull it off, just like we did the stolen benefits. And we did so in a few months because our team stepped up to the challenge. But I have learned with this team that it's been years of under budgeting, years of understaffing, and years of not acknowledging on the record the lack of seamless services to use technology to get this work done so that we can extract information like exactly what you're asking. And right now, it's mostly done by hand using technology, acknowledging that, but in a very laborious way.
Well, I certainly appreciate your honesty, your candor, and your answers because it is difficult in each of our districts, right? We see these children, we know these children, we know those who are trying to fill in the gaps, right? So I appreciate that. Thank you so much, Chair.
Thank you, Madam Vice Chair. Delegate Heinbaugh for a question.
Thank you, Madam Chair. I'd like to start out by thanking you and your organization for what you do to help needy Marylanders. I'm familiar with several of your programs. You have a lot of people out in the field doing a great job for you. I'd be remiss, too, if I think I didn't thank you for your personal commitment and candor, which is, as Delegate Jones said, is refreshing. So my question has to do with public assistance for adults. It's on page 22. And the DLS analysis indicates that there's a pretty significant decline in caseload. I think, for example, the expenditures in FY18 and 19 were somewhere over $8.6 million, and they've declined to $5.3 million in FY23. And according to their analysis, the first half of this year, FY24, indicates that expenditures might be even lower. So I guess my question is, there's $7.1 million for that item, for that program. Is there something there that we don't know about? Why isn't there continuing decline reflected in the budget for that program?
So I'm going to give you a couple of reasons, not all of them, because we're still learning. And one of the things that I think the nation is grappling with, and Maryland is no different, is what does the quote-unquote new normal look like post-pandemic? So there's lots of writing nationally around what happened during the pandemic and how people either are getting re-engaged or not engaged in benefits in general. And that ties to the question we just answered from Delegate Jones, which is being able to rely on consistent data to understand where the same people that are served in multiple programs within their department interact across our administrations. So it's a lift for us right now, sir. And so what we're trying to figure out is better understanding why that's happening. And one of those things, to be very clear and to connect it to our MD Think work, for example, right now, if you are on the FIA team, the Family Investment Administration team, and you are working on a case, let's say for an adult that might have children and be in child support, one would think that because we also run the Child Support Administration, that our leaders in FIA can immediately access and do data mapping, and the answer is we cannot do that right now. And so being able to extract that information to better serve adults who need this kind of help is one of the things we're trying to really focus on this year. Understanding those interconnections between our applications, because in the case, again, connecting Delegate Jones's in your question, it's oftentimes the same people. So overwhelmingly in the state of Maryland, as is the trend in the nation, the majority of people who receive benefits in the state of Maryland are actually children under the age of 18. And when we disaggregate the data, we then see other buckets. It's seniors or young adults with disabilities or disabilities. And we're trying to better understand these connections so that we don't have the kinds of drop-offs, and we can better understand what are the points where people drop off. Is it in the application process because we make it harder for you? Is it because we have a disconnection in a jurisdiction level or something else that we're learning? So I'm hoping in the response to your question, Delegate, that we are able to help you see that there's different levers that we're trying to better understand post-pandemic to make sure people get the help they need when they need it.
But why would the second half of FY24 be different than the first half in terms of caseload and expenditures?
I'll have to look into that a little bit more and ask our team to better understand.
Okay.
Just
well,
because that's what I shared with you is what we know. There's probably more that we don't know, but we're happy to get to look at the data a little bit more and to provide an additional response to you and the committee. Happy
Okay.
to.
Thank you. Thank you, Madam Chair.
Thank you, Delegate. In your response, can you make sure you please include any budget assumptions you're making on caseload changes, please?
Absolutely.
Thank you. I appreciate that. Delegate McCaskill for a question.
Valentine's Day to everyone. So I just want to say to the kind words that my two colleagues mentioned, I just want to say me too for the candor of your staff. My question is I'm on page 30, and specifically I don't know why I'm trying to read this with no glasses. Okay. It's just for the FIA, the child support pass-through, to better align with recent experience. What is that? I'm on where it goes, line 1, 2, 3, 4, 5. Child support pass-through to better align with recent experience, the 3.5. On page 30.
It's it was.
Just curious about the experience.
So this may be a better question for Ms. Zimmerman, but what
okay.
I believe is
No
that
problem.
what is referenced here is what the experience has been based on our caseload, how many dollars actually get passed through from child support to our to TCA.
Okay. Okay. Well, is there a next panel after you? Oh,
I don't know, but what I was going to say is the reason why I was debating it with my colleague is because I think the language as it's written here is different than the way I'm interpreting it,
Okay.
which is a larger policy consideration for the legislature and the governor consider moving forward around child support pass-through policy in general. And what that means is that if I'm a dad and I am required to give child support and Carnitra is my child, and her caretaker is someone who's receiving benefits, what's the pass-through between child support going to my child? And that's the way I was thinking about it. Okay. So I just need to make sure that Ms. Zimmerman is and we are speaking of the same thing, and if we're not, it's okay, but I wanted to make sure that I'm not misspeaking on the record about this particular line.
Okay, I just wanted some clarification. Thank you.
Okay, thank you. Ms. Zimmerman, do you want to help us understand this now, or is it better for after? I wouldn't mind hearing.
That'd be great.
Thank you.
Sorry about that. What that line meant was the budget itself just aligns with the fiscal 23 expenditures for the program. So it's just based on what they actually spent in fiscal 2023, which was lower than what was in the budget in 24, which was itself based on a prior year experience.
That's helpful. Thank you. Is that aligned with what
It
you were?
We were kind of, yeah, we were.
Okay.
Yeah.
Got it.
And interestingly, it is. We'll be hearing more about this in the future because it's a larger policy discussion around multiple strategies for Maryland to be imagining and thinking about regarding getting more cash benefits to the people, and it's something that we'll be looking at.
When will we be hearing about this? This is an area of passion for me.
Yeah, not in this budget cycle.
Oh,
that's the honest answer.
Well, that is a bummer. Okay. Well,
I wish we all had a magic wand.
I know. Don't
not
I
in this budget
as well.
cycle.
Understood. Thank you. Well, please keep me in the loop on those discussions. I would love to work with you on that.
Happy to.
Thank you for your question, Delegate. So I have a couple of questions related to EBT theft, please. So last session, the General Assembly passed legislation enabling the department to reimburse EBT fraud victims for both cash assistance and SNAP benefits stolen from them. So the federal government, as noted in the DLS analysis, only partially reimburses for this. So they cover, at least for now, the SNAP benefit component. The General Assembly appropriated $8.1 million, 6.3 of which from federal, 1.8 from the general fund for FY24, but it looks like expenditures from the general fund could be closer to $5 million for this fiscal year. And it sounds like you all are using existing resources, shifting in order to cover that for this fiscal year. So with the federal funds set to expire in September, and hopefully they renew, but nobody can predict what's happening in DC right now.
No.
So I'm hoping you can comment on the following, and I know you referenced some of it in your testimony, Mr. Secretary. So the FY25 allocation is $27.9 million, almost all of it from the general fund. Is this going to be enough in your estimation?
Thank you for the question, Delegate Shetty. To provide some additional context and a little bit of the behind-the-scenes sausage making on this, it's important to share some of this information, so we're glad you asked the question. So we are trying to manage essentially multiple parallel moving trains so that we can provide benefits to Marylanders. And so in the first phases of implementation of replacement stolen benefits, we were able to rely on a larger share of federal dollars. And so to give some context, FY 2024 had, as you mentioned, a little over $8 million budgeted. Of that $8 million, the federal funds represented 6.2 and change in million dollars. And from the state funds, it was $1.78 million. That represented the $8 million. That flips in this next budget. And the reason why that does and why it's calculated as a total is that the baseline budget that was included was $6.4 million in general funds, approximately $1.57 million in federal funds, and another $19.8 in general funds, which have been budgeted. These are based on what we experienced this last year. So if we hope that we do not have increases in the theft of benefits, we will have enough. What is different, though, to the question, at the root of your question, Delegate Shetty, is that if the federal government does not restore the ability of states like Maryland to use SNAP dollars to replace stolen benefits, the state of Maryland will be on the hook for every single dollar to replace those dollars. So when you think about the $27.8 million for FY25, the state of Maryland will have to replace all of them. And so we are looking at just the first quarter of the federal fiscal year that would end, the last quarter that would end September 30th of 2024,
right,
which is why you only have that $1 million and change from the federal government. That so we hope that the federal government will include in number one, the passage of the Farm Bill, which we have publicly advocated for with Maryland's federal delegation. The governor and members of the cabinet have twice met with the federal delegation about this exact issue. We know we have support from the majority of Maryland's delegation on this issue. So we are advocating, we are encouraging our community advocates across the state to advocate with us because we can't do this alone. And if all that works and we get the federal money and we have the state money, we believe we'll have enough to get us through June 30th of 2025.
Got it. Okay. And so I think you might have just covered my last two questions related to this. So if the federal government reauthorizes the Farm Bill, which might not happen, and the EBT theft benefits are reimbursed by the feds, then what will happen to the remaining allocated budget?
So Maryland will have to pay for it all.
No, if the feds do reimburse, if it is reauthorized and we are able, then and we have appropriated $29 million or $27 million, then the balance will stay in the general fund or it will go to other benefit programs?
From what I understand, and this is one of those technical Maryland rules, so anyone is welcome to correct me if I'm wrong, it will remain, and then we would have to seek permission through DBM and the legislature around any changes to that existing allocation.
Okay, got it. Okay. And then, yeah, please.
Madam Chair, if I may add, and this dovetails to our responses to the recommendations, given the uncertainty that the Secretary has outlined, any cut to these general funds, including the $7.5 million recommended by DLS, throws that much more risk and uncertainty into this whole process.
Understood. Okay, got it. Thank you. Further questions from the subcommittee? Okay, seeing none, thank you so much, DHS team. Appreciate you. We do have two individuals signed up for public testimony, and per committee guidelines, witnesses are limited to 2 minutes each for their oral testimony. I will call them up: Anthony Crawford with AFSCME Local 423 and Christopher Malahan. You may join us at the table. And I will note that in addition, as you are settling, colleagues on the subcommittee, you will see in your floor system written testimonies submitted by the Maryland Food Bank, Maryland Center on Economic Policy, Homeless Persons Representation Project, and Maryland Rise. Okay, you may begin your testimony.
Good afternoon, Madam Chair. My name is Anthony Crawford. I'm from Baltimore City FIA Department. I work at the location that's known as Dunbar Orangeville, which is the east side of Baltimore on Biddle Street. The reason I'm here today is to just talk about a couple of things that are affecting the workers as far as us doing our work. One of those things would be short staffing, as you've heard Secretary Lopez and the other leaders talk about. With the short staffing, that part plays into the reason why we can't serve our customers properly. It plays a part into everything that you guys are talking about as far as the budgets are concerned, with not being able to keep the 96% they were to do because of short staffing, because we don't have enough individuals to process the cases, to take the applications, to speak to the customers. The reason though some of the things that it does, as I said, with the short staffing, we can't serve our customers because we're having to do multiple tasks. If I take Delegate McCaskill's application, we are supposed to have a process where there's a processing unit that takes care of that. But because that doesn't happen, it winds up coming back to me after the time frame that we're supposed to do the expediting, which makes us fall out of compliance. So because of the staffing, that's the main thing. It's taking a toll on our workers as far as their mental, because it's so much coming back at us that we're not able. I'm not going to say we're not able to do, but the fact that it's coming back to us, when if we had enough staff, we would be able to take care of it in the beginning. To whereas though we're looking at our times in the office where we're trying to train individuals, that also plays a part, because individuals aren't able to be properly trained on how to do the programs. So with those things being part of why we aren't able to hit the proficiencies like we were supposed to, is why I wanted to speak today.
Thank you so much, sir, for your testimony. We really appreciate you being here, and thank you for your service to our state. Do any colleagues on the subcommittee have questions for our panelists? Thank you so much for being here today. One more attempt, Christopher Malahan. If you are here, you may join us. Okay, I don't see them. So thank you all so much. That concludes the budget hearing for DHS Family Investment, and we will be back tomorrow. Thank you.